Hello, this is a virtual microscopy slide of an amoebic abscess of the liver. Let's orientate ourselves. This is the area of the abscess, so this whole area here is abnormal. And this is the liver that is not involved by the abscess. However, it is quite abnormal looking because there is a lot of congestion and also hemorrhage. Let's have a quick look at the uninvolved liver parenchyma. We can see the hepatocytes that are arranged in cords, and the cords are quite widely spaced apart because of the presence of some edema and congestion. The hepatocytes themselves are polygonal cells with central rounded nuclei and quite abundant granular cytoplasm. So these are viable hepatocytes. Let me move to an area where we can see a portal tract, and here we can see part of the bile duct, the artery, and it's quite difficult to appreciate here, but this is the branch of the portal vein. So we have the triad of the hepatic artery, the bile duct, and the portal vein branch within the portal tract. Now moving towards the abnormal area, we can see here that the architecture of the liver is completely disrupted, and there is this area where the tissue appears very loose and amorphous. On higher magnification, we can see that there is a lot of granular necrotic debris. So all this granular material is actually necrotic material, and they used to be viable hepatocytes here. We have some residual viable inflammatory cells, mostly chronic inflammatory cells, with lymphocytes seen here. And there are some areas where there are preserved viable hepatocytes. And here we can see the accompanying chronic inflammatory infiltrate with some lymphocytes and occasional plasma cells. Moving on to other areas, we can see that there are some of these rounded to oval structures. They are actually quite degenerate here, and these are the amoebic organisms. If we look carefully into this one, we can see that there is an eccentric round nucleus, and we can see this little shadow which is reddish in color, and this is an ingested red blood cell. These organisms are about the same size as macrophages. They have eccentric rounded nuclei, and it's difficult to appreciate the nuclei here because many of these cells are degenerate. Here you can see the nucleus, and quite often the organisms ingest red blood cells, so we may sometimes see red blood cells in the cytoplasm. There are several other highly degenerate amoebic organisms here. Let's learn a bit more about amebiasis of the liver. The causative agent is usually Entamoeba histolytica, and the route of transmission is fecal-oral. So what happens is that the amoebic cysts are actually ingested in contaminated food or water, and then they go into the gut where they form trophozoites. Trophozoites can then cause ulceration in the colon, and this is known as amoebic dysentery, so this may give rise to some diarrhea. And from the areas of ulceration, the trophozoites can then enter the portal circulation, travel to the liver, and this is where they can give rise to necrosis and inflammation and abscess formation. This condition occurs most frequently in tropical regions, for example in Asia, Africa, and some parts of Central and South America. It tends to affect males more frequently, and the peak incidence is about 40 years of age. Clinically, the patients may experience some right upper quadrant discomfort, fever, and diarrhea, especially if there is amoebic dysentery as well, with gut involvement. There may also be secondary bacterial infection as well as fistulation. So you can see here, there is an abscess in the liver, and this can potentially break out into adjacent organs. For example, it can erode through the diaphragm and give rise to amoebic empyema in the right pleural cavity. The diagnosis is usually made on a combination of serology and imaging, And if there is a fine needle aspirate or a biopsy of the liver in the area of the abscess, the organism can be visualized under microscopy, and also PCR can be performed to confirm this organism. Stool examination in the context of intestinal amebiasis can also reveal the organism on microscopy and PCR, and biopsy of the infected bowel can also show the presence of organisms. This is an example of an interactive virtual pathology specimen, and this specimen can be accessed for free in our free online pathology resource, Pathweb. The link for registration is in the video description. Grossly, we would see this abscess cavity, and this is often described as having thick brownish material that resembles anchovy paste. So it is very pasty and it is brown in color. And we also have some suppurative inflammation in the surrounding liver. There is a separate video describing the gross pathological features of amoebic abscess of the liver, and this can be found in Pathweb. Microscopically, we can see the amoebic trophozoites in the area of abscess. They are roughly the size of a macrophage. They are about 40 to 60 microns long and oval shaped, and they have small round eccentric nuclei with pale eosinophilic foamy cytoplasm. They may also often ingest red blood cells, so we may be able to see degenerate red blood cells in the cytoplasm, and I will show you some examples later. These organisms are PAS, periodic acid Schiff positive, so this is a useful special stain to perform. And this is usually surrounded by granular necrotic debris, as well as a predominantly chronic inflammatory reaction. We can see here that there are mostly lymphocytes in the area of inflammation. Here is another picture showing the granular amorphous necrotic material, and we have some viable hepatocytes here. And this area shows the chronic inflammatory response. And here again, a higher magnification picture showing large areas of amorphous necrosis. Here we can see the organisms, which are oval in shape, and they are quite degenerate here, so we can't see the nucleus very well. This is an example of the PAS stain, which highlights these organisms. Here is an example of a biopsy of an ulcer in the colon, and this is the colonic mucosa. On the surface, we can see some inflammatory exudates and fibrin. And if we look carefully in this area, in the exudates, we can see the amoebic organisms. These are oval, and some of them have ingested red blood cells, as you can see in the cytoplasm, and another one here. On higher magnification, these are the organisms. We can see one here with the eccentric nucleus and an ingested red blood cell, and another one here with the red blood cell. And here again is another group of organisms just overlying the mucosa of the colon, and this is the PAS stain highlighting the organisms. Hence, in summary, this is an amoebic abscess which is characterized by large areas of necrosis of the hepatocytes with accompanying predominantly chronic inflammatory response. And we can see the inflammatory cells here, which in this instance are composed predominantly of lymphocytes. And in some areas, we can still make out viable amoebic organisms, which are oval organisms with eccentric nuclei, and some of them have ingested red blood cells. These can be highlighted with the PAS stain. Thank you.